Trump's medical bill would cost an average American citizen at least $100,000, report says. No, you can't buy that care in the first place. A billionaire might be able to somewhat recreate it, but not for $100K. Yeah, that's for 3 days. My 6-day stay cost $160K after all said and done. $100,000. You're dreaming. This is America. There were helicopters, experimental treatments, round-the-clock doctors in attendance. I'd say $500K plus. I am guessing that doesn't include the helicopter ride and Secret Service. Being the median salary of a US citizen is $33K and that most Americans have crap insurance, the basic takeaway is COVID will bankrupt you and possibly kill you at the same time. Trump and Republicans want to make healthcare more expensive, less available, and don't care if you die while getting care on your dime. Fuck Trump. TBH, that seems low. They must have forgot the helicopter ride. An airlift is approximately $20,000. My GF had a medical emergency. The trip to hospital cost $3.00. While there, she had 2 options to see: drive, pay $4.00 or pay $35. The $4.00 was FIFO, the $35 was cut the line. The DR looked her over and prescribed commercial medicines. All toto the cost of care was $75.00. It's so cheap we decided not to use any insurance. 4 days later, today, her condition is 70% better and improving quickly. This is in Vietnam. The DR is board certified. The facility was clean and ultra-modern with modern equipment. This is reason number 23 that I no longer live in USA. Contrast that with whatever the American system is. https://udo.b/cedoc/8. But for Trump it only cost $7.50. Federal minimum wage is $7. Let's assume someone is working full-time and able to use 50% of their income before tax, impossible, towards their medical bill. It would take them 13 years, 2 months, and 18 days to be able to afford this $100,000 treatment. Medical coder, my company works in CA, the average COVID admission, from what I've worked on since March, runs around $150K. I've had a few short stays that are under 6 figures, 70, 80K, and a couple long stays that were over $1 million. $150K would be an average 1 week admitted without a ventilator. I can't believe the medical bills are not part of the conversation about COVID. Most people are not going to recover from a bill like that. If you get sick enough to be admitted for COVID, you are so financially f***ed. Why aren't more people talking about this? 2 million infected. $100,000 each to treat. That would cost $200 billion. If we go the GOP herd immunity route, literally the plan of Trump, but he said herd mentality because of course he's illiterate, that would mean we infect 200 million. Treating that many in the USA would cost $20 trillion, or 10x the federal budget, and almost as much as our entire federal debt to date. I went for 3 hours and it cost me $7,700. https://imager.com/n9kqhua. JPG. My daughter had to stay 3 nights at Children's Hospital. $4,000 a night just for the room. No treatments. Then Dairy Queen asks me if I want to donate to them. So socialized medicine isn't communist for the president and people in Congress, but somehow when it applies to the general public, it suddenly is. It's insane how inaccessible healthcare is in the US. Here in Belgium, if our prime minister or king would catch the virus and end up in a hospital, they perfectly could end up in a hospital room next to people who live off of social benefits. Sure, they'll get more attention from the doctor, but when it comes to the actual care, everything will be the same. There are no premium hospitals here. The rich and powerful get to lead lives of ostentatious excess and comfort because they fuck the rest of us out of every penny they can. Imagine how much the wealth of these government-funded assholes could help millions of Americans. Even though we all know that is low, it would take Trump 133 years and change to pay that $100,000 back through taxes. LMAO. 100K? Wow. Private office in a hospital? Helicopter rides? All those doctors attending to me and all of that medicine? Please. My son had surgery in 2014, and even though we spent 5 days in the hospital, at first in a huge room with 10 different kids, then a room shared with one other kid, never a private room, his bill was over 120K. No helicopter ride. No personal staff. No fancy personal office. No fancy hospital food. No big staff of doctors. No ride outside with Secret Service. Even though we had good insurance, we still came out of pocket over 20K. This is going to be worth at least 250K, if not more, on our dime. He won't pay for anything. Good ol' socialized medicine. The same he's trying to not have people be able to get. Good thing he's paying so much in federal income taxes to offset the costs he's incurring. Something welfare burden. /Sigh. So about 133 years of Trump's taxes, got it? I'm in Canada, I had a bad cough so I went to get tested. After I got tested the nurse told me to get a respiratory screening as a precaution. I saw the respiratory specialist and he said that I should go to the ER to get a X-ray and some stronger medicine. I got a X-ray in 20 minutes and they gave me a steroid inhaler. They said to get some rest and see how I feel. I walked out of the hospital and got my COVID results the next day. Negative. This cost me $10 and that was for the parking. Yeah, but how much would the second day in the hospital have cost average Americans? Republican hypocrisy. On Trump's taxes, he is just so smart, taking advantage and perfectly legal. On food stamps, fucking leeches, scum taking advantage of our hard work. On Trump's free healthcare, he was brave and deserves the best care. On healthcare for anyone else, irresponsible, go back to your country. Don't be scared of the coronavirus, he said. Just be scared of the repo men after. Capitalist healthcare is repugnant and anyone who supports it that isn't rich is a slobbering idiot. Wait. Shouldn't that say America just paid for Trump's medical bill which cost the taxpayer more than $100,000? Whoa, that is nearly 2,000 years of Trump taxes. Rule of thumb $35K a night plus treatment, med scans and more. Closer to $500K. The nuance that a 3-day hospital stay would financially ruin many/most people was completely lost on these schmucks when they decided on this course of messaging. Beside being insanely offensive to the millions of people who have lost a loved one, it is also offensive to anyone who even has a clue how expensive hospital stays are. You're talking a luxurious suite of 5 or so rooms in a 5-star hotel with the best doctors, medical resources, and medical treatments money can buy. Complete with a parade for any idiot admirers hanging around. With a return helicopter trip to my hovel and continued and closely monitored medical service while I recover? This average American thinks your estimate is a fantasy. The real bill would more than bankrupt an average American. Don't forget to add in the priceless/intangible cost of the Regeneron antibody cocktail. No way in hell the average Joe is getting access to a drug in clinical trials via compassionate use when the use isn't even compassionate. In other words, Trump wasn't actively dying when he received this medication, and compassionate use authorizations are for people with no other options and presumably almost dead. No one would qualify given that you can't really be dying with early stage COVID, as this drug is under investigation for early stage COVID pneumonia. Note that Trump does not meet the first requirement here, and anyone treated with this therapy should not meet this criterion. https://www. FDA. gov/news events/public health focus/expanded access. TL/DR, I'm willing to bet virtually no one has access to the Regeneron antibody cocktail outside of clinical trials aside from the VIPs of VIPs. He has paid $750 so he owes us $99,250. That seems low. The treatment plus a standard hospital room with standard staffing, maybe. I've read plenty of articles about patients who have ended up with COVID-related bills that were far higher than this. They can't afford to pay them, yet their tax dollars are going to fund Cheeto's recovery.